right, good morning. Welcome to Sleep Grand Rounds this morning. I'm Rahamat Mansaray, one of the Sleep Fellows and the last one to give her presentation. Thanks for being here. Today, I would like to talk, my title of my presentation is called Commercial Technologies in Pediatric Sleep, a focus on safety. And this was kind of inspired because I plan on practicing pediatric sleep medicine. And I felt that there are a lot of things on the market that parents are exposed to that I'm not so sure about, and they ask me questions. And the only advice I can give is, as long as it doesn't cause harm. But what does that mean? And how do I, and when I say harm, what does that mean to parents? And I think it's important that I take a deeper dive into that. And honestly, I feel like all of us should know as sleep providers, because as we know, families, people in the grocery store, as soon as they hear that you're a doctor, all the questions come flooding in. So I hope this can help. Open the chat. So first off, what you can expect to learn from this presentation is one, first and foremost, how to describe the pediatric sleep environment. And we'll go beyond the Back to Sleep campaign. We're going to dive deep into the AAP recommendations. Second, I would like all of you to be able to identify which agencies and organizations regulate these products and what is the safe standard and what happens when things are deemed unsafe. And three, indicate which sleep products comply with pediatric safe sleep guidelines. And with that, of course, we can't review the thousands and thousands of things on the market, but I hope that after this presentation, you guys will have that confidence and feel equipped to know where to go to find resources about safe sleep and use that to use your best judgment to judge these products, because they're coming fast and they range from a couple of dollars to thousands, and families want, even if it's only guaranteeing an extra hour of sleep, families want that. So first, I would like to start off with statistics about SIDS and what's currently going on. And in the United States, we're still seeing that about 3,500 infants dying of sleep-related deaths. And that's still happening today, even since the Back to Sleep campaign. And this includes sudden infant death syndrome, ill-defined deaths, and accidental suffocation and strangulation. These deaths typically occur in infants less than 1 year of age. And for the most, sometimes they have no immediate obvious cause. In 2020, there are about 1,389 deaths due to SIDS, about 1,062 deaths due to unknown causes, and about 905 deaths due to accidental suffocation and strangulation. And you guys can see that pie chart on the side there, SIDS in the blue, and in the green, the accidental suffocation and strangulation in the bed. Honestly, I see those in the same category because a lot of these things are happening overnight in a quote unquote unsafe sleep environment. And of course, the unknown causes can be a number of things, right? It can be questionable, it can be abuse, but again, that can still include things that happen in the sleep environment. So how do we define SIDS? Or as I've just learned, and this is coming after being a pediatrician for 3+ years, SUIDS. I have never heard this term before, so I'm curious if anyone else has, but this is described as sudden unexpected infant deaths. And this can be divided into explained and unexplained. And SIDS so happens to fall under the unexplained category. And I'll try to break this down because it's, all these acronyms and SIU, it gets confusing. But I'll try, for the purpose of this presentation, we'll just loop everything in as SIDS. But I thought that it was important that we understand, because when it comes to statistics in the government and medical examiners, they really do break this down. And this is why we got the graph that we did on the previous slide. So unexplained SUID are deaths considered to be sudden infant death syndrome by a medical examiner. And SIDS is defined as a sudden death of an infant younger than 1 year of age that remains unexplained after a thorough case investigation. Unexplained SUID also includes some cases that are not considered SIDS, but lack a clear explanation. Now, explained SUID deaths are deemed by a medical examiner caused by something specific. And deaths caused by fatal child abuse or underlying medical disorders such as metabolic disease. And then they are also looped in deaths that are caused by accidental suffocation or entrapment during sleep. So you can see how this can get confusing when you break it down into the two categories, especially when we're talking about safe sleep, because our concerns kind of fall into both categories, right? SIDS as well as suffocation or entrapment during sleep. So that's why for the purpose of this presentation, I'll just loop everything together and talk about SIDS as a whole. Unfortunately, the sleep-related infant deaths has, well, not unfortunately, it has declined since the 1990s, but unfortunately, recently in the last 10 years or since the 2000s, we have seen a plateau, especially in the Black and Native American Alaskan infants. And it's even doubled compared to white babies. So this is still a crisis, and now we're seeing that it's leaking into and showing kind of that healthcare disparity. What we can attribute to this decline, though, the positive, is number one, the American Academy establishing the safe sleep recommendations in 1992. The second thing we can attribute to this decline is the initiation of what we all know to be Back to Sleep campaign in 1994. And in 1996, there was the release of the Sudden Unexplained Infant Death Investigation Reporting Form, which is also known as SUID form. And this is kind of how, like a database that helps everyone categorize and understand that better. So after these three kind of strategies and recommendations were put in place, we found a decline. But unfortunately, in the last 10 years, things have kind of plateaued, which I would like to highlight here. This graph, again, breaks it down as the combined SUID rate, which you guys can see, we saw a very good decline right there in that kind of 92, 94 timeline. But since the early 2000s, we see that plateau, and it's still happening till today. And then you also see sudden infant death syndrome. We saw a very steep decline, and it's still kind of going down. And I wonder if that is because we are kind of classifying things better. And then for unknown causes, it's kind of remained stagnant. But what I would like to bring our attention to is the accidental suffocation and strangulation in bed. That is slowly going up. And again, is that because we are categorizing this better and maybe those are leaking out of just sudden infant death syndrome being labeled that way? Either way, it's concerning. I feel like we know more. We do a lot of education. I know in my residency, we talk about this a lot in hospitals when babies are born. You know, we model what is a safe sleep environment for families. So I feel like the education is out there, but I'm concerned and, you know, curious, and we could talk about this later as a group as to why that seems to be creeping up. And as I stated before, all the rates have kind of plateaued. We're at a standstill right now. So what exactly does the AAP recommend as safe sleep? It goes way more beyond back to sleep and supine sleep, even though that is a major part of that. The AAP breaks down the safe sleep recommendations into three categories, A, B, and C. A category includes the kind of first chunk of it that we all have heard about and know very well, includes supine sleep, back to sleep, use of a firm, non-inclined sleep surface, a bassinet crib, or portable play yard. And this surface should not be inclined more than 10 degrees. And room sharing, they actually recommend up until, well, not up until, but for a minimum of 6 months, of course, without bed sharing. And the avoidance of soft bedding and overheating. Soft bedding includes such as pillows, fluffy, cute toys, stuffed animals, blankets, all those gorgeous things that you find in the baby department are not safe for baby sleep. And there are additional recommendations to help reduce SIDS, and A-level recommendations include human milk feeding, avoidance of exposure to nicotine, alcohol, marijuana, opioids, and illicit drugs, routine immunizations, use of a pacifier, but they also highlight just the pacifier and not the pacifier holders or clips or strings or anything of that nature, because that can lead to strangulation if babies are tossing and turning. And avoid overheating and head coverings in infants. They go on to further explain, babies do not need hats in the bed. I remember, and I know I'm young, but man, I've been training in medicine for so long. I can't remember if it was in nursing school or medical school, but I remember someone explaining to me, how you feel is how the baby feels. If you don't need a coat, the baby doesn't need a coat. If you don't need a hat, the baby doesn't need a hat. And that's kind of stuck with me. And it goes against everything my African auntie said, every time they see my son, he needs socks, he needs a hat. And they look at me with these like horrible eyes, like, why is this young lady freezing her son? And I'm like, touch, he's warm, he's fine, it's okay. So I think it's important to kind of, demystify grandma's advice. Yes, Dr. Stroh.
So in terms of your safe sleep environment, you had one of the issues there was in regard to incline, and then what was the other issue? I keep reading.
Above it or below it? Like room sharing, avoidance of soft bedding, that one?
Bed sharing.
Yes.
I think, that's always been a hot button issue with the anthropologists.
Yes.
And mainly anthropology.
So I will counter that, right? Because I assume anthropology is talking about like cultural things and maybe there's a bias to it. So I am 100% Nigerian. I always told people growing up, even though I was born here, as soon as you cross the threshold to my house, you've entered Nigeria, point blank. And there was all types of bed sharing. There's all types of breastfeeding in bed, which I thought was normal. Like kids sleep with their parents forever. But when I talk to my mother-in-law about this or other African aunties and grandmas, they say, hush, hush, your science doesn't make sense. But I think that's because we are actually not tracking said deaths back home. I can only speak for Nigeria, I can't speak for the whole of Africa, but there's nobody talking about this. There's nobody talking about babies suddenly dying. It's just hush, hush. There's always this kind of hesitancy around death, especially for younger ones. It's actually culturally, you're not allowed to go to deaths of people younger than you. You're not allowed to go to funerals. So I think that they don't understand that this is happening. It's occurring. It's just, we don't know about it. We don't talk about it. A woman loses a child, next month she's pregnant. So I think it's happening, and you can send an anthropologist my way. I would love to go to Africa and implement back to sleep and all these wonderful things that have helped us. So I don't know. Does that help, Dr. Stroh?
Yeah, these anthropologists have been talking about this since before you were born. And the AAP came out with this no bed sharing without data. So
I see.
And so that tension is still there. And I say, well, that may be true, but people have been embedded for 2, 3, 4 years in El Salvador, those sorts of places. And so, they think that mainly because other features, that is breastfeeding, how you sleep, where you sleep, what you think about, and that you sleep long enough so that you don't sleep heavily enough if you're in an industrial society, right? So it's all right. And then then all these other things came out here. For instance, they do association studies. They find that sudden infant death is associated with the BMI of the mother. Some guy
That's tough.
some guy in the discussion section said, well, they roll over, and you go,
I mean,
no. See, that's a touchstone issue.
I mean, but even if your BMI is not elevated, just comparing you to a 6-pound infant, it's concerning. But yeah, I come from a community that advocates for bed sharing, but as a pediatrician, I'm terrified and I do not recommend it. No, you are fine, Dr. Stroh. I love it. You're helping me get more comfortable. But yes, the second parts to talking of the A-level recommendations includes human milk feeding, avoidance of exposure to nicotine, alcohol, marijuana, opioids, and illicit drugs, no use of a pacifier without passy clips, routine immunizations, going to your doctor, of course, not overheating the infant. And they do not recommend against cardiorespiratory monitors, and we'll get into that in more detail, but it is not, they don't recommend it as a strategy to reduce SIDS. They want you to adhere to the safe sleep recommendations. In addition, if you would like to spend, you're guilty, you have an outlet. Just practice your safe sleep. And if the outlet reduces your anxiety so you can sleep at night, no problem, but still back to back to sleep for baby. And of course, supervised tummy time. This is how kids get strong, strengthen those core muscles so that if they do roll over, they can roll back over. Alrighty, I'll move on to the B level recommendations. And it's just one simple one: avoid the use of commercial devices that are inconsistent with safe sleep. And these B level recommendations is kind of the root of this presentation today. And I'm honestly very excited to go over this with you guys and hope that you walk away feeling confident, being able to speak to patients, family members about the many, many things on market and what is safe and not safe. And for the C-level recommendations, they state that there's no evidence to recommend swaddling as a strategy to reduce the risk of SIDS. Again, they have guidelines around swaddling, but there's nothing that shows that it prevents SIDS, so to speak. And then, of course, they want continued research and surveillance on the risk factors, causes, and pathophysiological mechanisms of sleep-related deaths. And my favorite part of all these recommendations is the ultimate goal of eliminating these deaths entirely. It is very sad and unnecessary to lose your child, wake up and your child is not there. Even before becoming a mother, I found this terrifying when I first learned about SIDS. I was a freshman in high school, and one of the football coaches lost his child to SIDS. And I remember we all wore blue and blue ribbons. I was a teenager. I didn't understand the extent of all of that. I didn't know what SIDS was, but I thought that him waking up and his child was no longer there was the worst thing ever. I guess I could have foreshadowed becoming a pediatrician, but anywho. So I stand with AAP, and I hope that this will one day be a disease and situation of the past, and we never have to talk about this with families. So now let's just go into recommendations in a little bit more detail. Soft bedding. It's recommended that weighted blankets, weighted sleepers, weighted swaddles, any weighted object not be placed on or near your sleeping infant. Again, the AAP is comfortable with dressing the infant in layers of clothing and they prefer, no loose clothing, no blankets, no pillows, no soft fleece things with clouds on it. If you feel like your child is cold, put them in a onesie, put them in 2 onesies, but don't overheat, change the environment. Please do not put them in anything loose. And of course, a no head covering while sleeping, because this can also lead to kind of suffocation if those things fall off. As we see, even when we're awake and monitoring these babies, they can't keep those hats on. So why do we expect them to keep it on when they're sleeping? And they're okay with wearable blankets. And I wanted to highlight to you guys, it's actually my little pumpkin at daycare in a wearable blanket, which is fine. As you guys can see, he can flap his arms. It really is kind of not for sleep because he finds it entertaining and he flaps his arms like a penguin. So that's a little sunshine that I'm bringing to you guys today on this rainy Tuesday. And then a little more detail about the home cardiorespiratory monitors. These are direct to consumer heart and pulse oximetry monitoring devices that include wearable monitors, and they're sold to consumers as wellness devices. These devices are not required to meet the same regulatory requirements as medical devices. And for that reason, the FDA does not want to designate them as something to prevent sleep-related deaths. Again, these are just For parents' comfort, consider wellness devices like kind of like the Fitbits and things like that to track sleep for adults. They do not prevent the risk for SIDS. And for that reason, the AAP does not say, they don't recommend not using it. They just want families to understand that when you have this doesn't take that risk away. You need to adhere to the safe sleep guidelines. And the FDA defines consumer wellness device as one intended for maintaining or encouraging a healthy lifestyle and is unrelated to the diagnosis, cure, mitigation, prevention, or treatment of disease or condition. They are very clear about that. So I wanted to explain what these devices are, so when they come to you, you understand and can answer families' questions. At the top left there, that one is called the Owlet. It's very popular in the pediatric world. As a resident, there were many ED visits based on the Owlet and families saying that their kid either stopped breathing or their heart rate went too low. And as we know, these devices are not perfect. The Owlet.
So let me just clarify. They want you to adhere to good practices, but these devices don't actually detect whether you're adherent or not to it.
Exactly.
Right?
Exactly.
So none of them sit there and say, okay, the bed's too hard, or the incline's too great, or the
you mean the actual
device itself does not give
the devices?
The bedding is too close, or those sorts of things that are in the grade A recommendation.
So wait, there are people that recommend that. I mean, that have standards for that, and I was going to get into that further.
Okay. I mean, but the devices.
No, yes, the devices do not, and this is exactly why the AAP and the FDA say these are not indicated to, and I'll repeat, diagnose, cure, mitigate, prevent, or treat. But no.
Monitor your heart rate, so like your Fitbit does.
Exactly. So I'm on the same page.
Device.
Exactly. I'm on the same page with you, Dr. Schultz, and hence the reason for this presentation, because this is what's being marketed to families.
Yeah.
They see this and they're like, oh my God, because we have scared the living daylights out of the world about SIDS. Okay. We have accomplished that.
Keep going.
Okay. So the Owlet again uses PPG technology, which we all know what that is. Thank you to Dr. Chang, to track multiple sleep quality indicators such as heart rate, average oxygen level, movement, and wakings. And the Nanit on the bottom right, it tracks breaths per minute, and it uses breathing wear and camera detail to give parents kind of data on how well their babies are breathing, and alerts them if something goes stops in the night or pauses, so to speak. Again, I think all of these products are just marketing to parents' anxiety, and I totally get it. I wanted to show you guys more details about what this breathable wear actually looks like. They have a breathable band. This is the Nanit, a popular one. They have it in a swaddle style. They have it in a swaddle style without arms, and they have it in a onesie. So it can grow with your baby and you can use it for a long period of time. But overall, it looks safe, right? Because it's the clothing that we talk about that is layering. It's not loose, soft clothing. And then this is the Owlet, as you guys can see here. It's a sock. It really is just like a pulse oximeter. And they, as you can see at the bottom, all the things they track: sleep quality, when did they wake up, just like those apps that we have that monitor, quote unquote, our sleep. Another one I would like to discuss in a little bit more detail is swaddling. And the AP says that when an infant exhibits signs of attempting to roll, which is typically around that 3-4 month period, swaddling is no longer appropriate because it could increase the risk of suffocation if the swaddled infant was to roll over prone to the prone position. Sleep sacks that do not swaddle and allow the baby to move freely can be used indefinitely, as I highlighted there at the top right here. So they said you can use that for as long as you want because it doesn't limit the infant's movement to roll. And again, they emphasize weighted swaddles, clothing or weighted objects within the swaddle are not safe and not recommended. They can place too much pressure on the baby's chest and lungs. And I understand why they emphasize this more than once throughout their recommendation policy. Parents believe that this provides added comfort. In lieu of them being there, like, oh, maybe they think it's mommy, but really it's terrifying. And I even had a daycare teacher recommend that to me, and I like my eyes shot up and I was like, oh my God, no, please, I'm not buying that. So what are the organizations that set these rules? I think we were kind of alluding to this earlier, Dr. Stroh. Oh, I think Dr. Carter actually has a comment. Thank you. We don't even have good normalized data for infant AHI, ODI, and PSG. How on earth can a home monitor purport to provide meaningful info on this? SMH. Agreed. So as we all went and I wanted to, as I was doing my research, I was like, who sets these guidelines and who enforces them? I'm like, I know about the AAP because I'm a part of it and I'm a pediatrician, but they're not a federal organization. So I did some diving and I wanted to share this with you guys so that you can have this resource and know where to go looking and how to advise your families where to go look for these standards of appropriate safety recommendations for the items that they're purchasing. As we know, the AAP is a professional association of pediatricians. They work alongside Congress and different levels in the government to give recommendations on safety legislation. As we know, they lobby just like other medical societies. Now, the Consumer Product Safety Commission, CPSC, is a federal agency. This is actually a part of the government. They issue and enforce mandatory standards, and they have the power to recall these products and demand a repair or a replacement or refund from these companies if they deem that they're not safe. Juvenile Products Manufacturers Association, JPMA, is a group of manufacturers in the juvenile product industry. They are not associated with the government. A JPMA certification means a manufacturer has gone through testing above federal standards. They must meet the standards of not only the JPMA, but also the ASTM to get this badge on their item. And I'll talk about the ASTM next. And these products must be tested annually. Now, the ASTM is the American Society of Testing and Materials. This is a non-for-profit organization, again, not associated with the government. They develop standards for consumer products and expand on existing mandatory government standards. Again, they go above and beyond what the government has already deemed as a standard. They get input from engineers, federal government representatives, manufacturers, retailers, test labs, even consumer advocates. And they analyze ways that consumers can use and misuse these products and issue warnings on the warning labels, essentially. So they help with the toys issue how things can go bump. And of course, we all know about the FDA, which is a federal agency as well. The Food and Drug Administration, we know them very well. And they oversee food, drugs, cosmetics, animal food, dietary supplements, medical devices, and biological goods and blood products. And they also have the power to recall products. So the two federal agencies are CPSC and the FDA. The Medical Society is the AAP, as we know, and then the ASTM and the JPMA are voluntary organizations that go above and beyond what the government recommends to issue labels and safety standards for toys, and companies can kind of go through their process and get these labels of certification. All right.
Has any product been recalled?
Yes. Do I know specifically? No, but yes. All right, news and pediatric sleep products. One, the CPSC actually did something that is huge. AP was very excited about this because again, we don't have the power to implement these things. We just give recommendations, but it's up to the government to kind of enforce them. So in June 2021, the CPSC passed a rule that any sleep products for infants aged 5 months and younger, defined as any product with packaging, marketing, instructions indicating that the product is for sleep or nap, with it, or any images of a sleeping infant, right? Because that can be deceiving. We can't expect everyone to be at a reading level, right? You put an image of a sleeping infant, a parent's going to grab it and say, okay, this is going to help us sleep. They said that these items must meet the existing federal safety standards for cribs, bassinets, play yards, and bedside sleepers. The AP was very excited about this and hoping that this will decrease that plateau that we've seen in the rate of SIDS. So this includes inclined sleep products, hammocks, cardboard boxes, in-bed sleepers, baby nests and pods, compact bassinets without stands or legs, travel bassinets, and baby tents. And then second, the FDA approved the SNU. So this is a really big deal because it's the first of its kind. It's kind of a smart crib, and I'll go into more detail about what it is later. But the FDA approved this, and it's the first of its kind. It's now considered a medical device, and it is not approved to reduce the risk of SIDS. What it is approved for is to keep babies in the supine position. So it is deemed a medical device for that reason.
You'll see this.
Yes, yes. And then furthermore in news, the outlet that we talked about earlier, the FDA actually issued a warning to them. It was to their product, the Smart Sock. They asserted that the Smart Sock should be classified as a medical device in the US because of the live heart rate and oxygen notification. So they now changed it to the Dream Sock. So it no longer gives that live data, it gives an average of your oxygen saturation. So they're working with the FDA to fix that, but I just wanted to put that out there that the FDA, the government is monitoring all these devices that are being marketed to families and issuing recalls or warnings if need be. So let's apply what we've learned. I hope that I gave somewhat of, it was a lot of information, but in a very short, concise way. I want us to take everything that we've learned about the AP recommendations, the organizations that enforce them, and apply them to some products.
Yeah.
Mm-hmm.
1700, sorry.
You talking about the SNU? Oh,
Yeah.
Snoop, yeah.
oh, yes, it is, right here. Exactly, it's very expensive.
I got.
You have to give us your review.
Well, they've not done any studies on it.
Yes, no one outside of the Happiest Baby company, which is the company that made it.
Yeah. And it would be, the first would just be to do EEG because it moves.
Mhm. Yeah, it's pretty cool. So I'm sorry, Dr. Stroh was telling us that he has a SNU in the family. So those of us that don't know what the SNU is, it's basically a smart crib. And they describe it as a responsive bassinet that uses motion, white noise, and swaddling to calm an infant and improve sleep duration and quality from birth through 6 months of age. It anchors the baby. It has an anchored swaddling apparatus that secures the baby on its back and prevents it from rolling to an unsafe non-supine position. They report that it adds about an hour to 2 hours of sleep per night with constant calming and womb-like sounds. They give you, of course, a daily sleep report on an app, and parents, they love it. They're paying that $1,700 for it, and now you can even rent it. This is just a quick video on how it moves, and it's pretty secure. Yeah, and this is the item that the SNU, not the SNU, sorry, that the FDA has approved of the first of its kind as a medical device to keep babies in the supine position, not to prevent SIDS. So we have to be careful about our wording. Dr. Oz says, a great way to create a sleep onset association problem. Now we have to develop the SNU for the toddler and the teenager to get away from that. Alrighty, so just to snoo in a little more detail, you guys can see how it works. As the bed responds, it kind of graduates to each level and it changes color. Once the child is calm, it goes back down to baseline, the blue color. If it keeps escalating and the child stays escalate for 2 to 3 minutes, the color turns red and the caregiver is expected to attend. So it won't just keep going indefinitely, right? Because the fear is that parents, again, are just gonna say, hey, this is safe, this is a perfect product, I can like put my guard down. But the SNU has kind of made something to safeguard that and force parents to respond to inconsolable infant. Just to SNU a little bit more evidence, as Dr. Ibrahim stated, there are studies out there, and these two that I found were sponsored by the Happiest Baby Incorporation, which I wanted to highlight. But without wasting too much time, they just kind of found that it increases total sleep duration for an average of about like 30 minutes. It increases the longest sleep period for about 42 minutes to an hour. So, you know, I think for our families, even patients without children, our insomniacs, if we can tell them, I think it was someone was making a joke, I gave you 40 more minutes. That's a big deal, especially for the sleep deprived family who's getting up every 2 hours, right? Oh, Liv, I have to go. I'm going to present a view now. All righty, so that is the SNU in a lot of detail. I wanted to spend time on it because it is now considered a medical device, and I think we should know about it.
They may be able to see themselves.
Yes. What do you mean, see themselves? This part.
That's good.
Okay, got it. So we're going to go into review and I want you all's advice on what you deem is safe. So this is Alpine Muffy Baby Ear Protection. And I just went on Amazon and I searched for baby sleep products and thousands of things came up. So this is just a handful of them for us to go over. They claim to reduce noise and prevent hearing damage and, dare I say, improve sleep. So how many of you would recommend this to your families?
No.
Wonderful.
I bought it and returned it.
You did? I'm so proud of you. I love the honesty.
So we forgot her headphone at one of the weddings, and so we had another wedding following weekend. So I quickly got this off Amazon. It does not help. My baby is crying the entire time. And it keeps falling off.
Yes.
So.
Hence why it's unsafe. I agree. So Suzanne was just adding that she bought this and returned it because it was not safe. It was falling off her baby's head. They actually bought it for a wedding. I assume not for sleep, but for a wedding to reduce noise. And just while the baby was being monitored, it was falling off. So you can imagine at nighttime, if we're all sleeping and that falls, that would be a terrifying thing to wake up to. So no.
So what's the evidence that there's hearing damage if you don't use it?
I'll be honest, I don't know. I didn't look into that. I was more into the it's not safe for sleep part.
Noise levels in the American household have increased steadily since 1950s. And so there is some concern about noise levels in general and what they do, what they can do. So there is some experimental evidence. We did some unpublished work on exposing baby rats to Guns N' Roses. At 60 decibels for 10 days and found that they did have a little bit of hyperactivity with their adolescents.
Oh, I wonder why.
Well, we were going to do the controls. Be much money at 60 decibels. I mean, what do you want?
All righty, so I'm so glad that you guys passed. You got that right. So the next product that I would like us to review, okay, good. No, don't cheat. So, but I kind of hit this one on the head. This is a weighted sleep sack, and they say it's gently weighted Zen 1 swaddle mimics the pressure your baby feels when held by you, helping babies to self-soothe and sleep through the night when they're not in your arms. How many of you would recommend this product to your families? Nope. And the AAP has, in their policy, they stated over and over, weighted products are not safe. They are not safe. So please just stay away from that.
How did those claims get through? That's all right. Go on.
Okay.
Thank you.
The next product is baby loungers. So some families actually place this in the crib. They place these in the bassinet, you know, so babies are comfortable. How many of you would recommend this to your families? So I said with caution, but I agree with you. So the reason I said with caution, and I think Suzanne can agree.
Yeah, Dr.
So I actually have the elephant one, the gray one, I'll be honest. And I agree with you, Sam. I'm not using this in the bassinet. I'm not using it for sleep. This is for during the day, when mommy needs to wash dishes, when I'm awake, when someone's monitoring. But when we need to go to bed at night and fall asleep, absolutely not. Because what I cannot demonstrate, which I probably should have brought it in, is those kind of arms, they flap up. And they're very flimsy and baby can roll into it, especially when my son was a newborn. I was terrified. I'm like, oh my God, no, he absolutely, I don't know how people feel comfortable sleeping at night. He could easily get entrapped in there. So if families use this, just recommend that it should be just for daytime when they're up and able to monitor their infant while they're in there, because we can't hold them forever. No. All righty. All right, this is Baby Maryland's Magic Sleep Suit. It's a non-weighted sleep suit. How many of you guys would recommend this to your families?
Yeah,
That's okay.
I don't use it, but it's just around.
Oh, wow, you like got all of this. I should have talked to you about this. Yes, I would recommend it because this will be considered a wearable blanket and dressing babies in layers is preferable to blankets or other loose items that can increase the risk for entrapment or strangulation. So this is okay. And this one I actually prefer to the penguin sack suit that they put my son in because he can have access to arms, legs, and roll over. Patented parent favorite.
Oh.
Yeah, it's all special. Sound, oh man, I'm cheating. How many of you guys would recommend a sound machine?
Yeah.
There's even been some studies, and I wonder if any of the attendings can, oh, look, someone else loved the Merlin, wonderful. If anyone else can recommend, like, has there been studies on increasing sleep in adults? In children, I found one where it says that it reduces the sleep onset latency. So it doesn't cause harm, just recommend that they don't put it anywhere near the crib or sleeping area. I'm okay with it, I have one, my husband swears by it.
So the parents is the Miami sound machine. We go to that.
Miami
Sound machine.
Miami sound machine? I don't think I heard of that one.
That's Latin music. That's
Oh,
a band in Miami. So it just depends on what you
Oh,
put
wow.
in there, right? You put white noise, you put.
yeah, they do. I love Dr. Ibrahim and Dr. Ross. They're like, this is another sleep association. Go ahead, Suzanne.
Because I know my nephew uses,
Mhm.
my sister-in-law uses this for her kids. And one night, the sound machine just turned off,
Mhm.
and he just woke up.
Really?
Yeah, so he's used, so he
Yeah.
used.
Wow.
So
So Suzanne actually put in a very interesting point, and I think Dr. Ibrahim and Dr. Ross can attest to this. She says that her nephew sleeps with the sound machine, and one day it went bump in the night, it broke, and he woke up. Was he able to go to sleep, or how was he until he got a new one?
And the parents have to go back in and.
Really? Oh, okay. Well, I don't use mine every night. Alrighty, so this is the Munchkin Lullaby vibrating mattress pad. The pad easily slips under a crib, mattress, or bassinet and creates a gentle, soothing vibration to help lull babies to sleep. And I actually have this here, and I'll give you the backstory. I didn't buy it, but I'm the only pediatrician in my house. So I can pass this around and you guys can see it. I just want everyone online to see it is not flat, it's kind of round. So keep that in mind for what you think when it comes to recommendations for your families. It turns off on its own. What did you say, Dr. Stroh?
roll off.
Exactly. So you can see they're showing two mattresses. I don't know how many people have two mattresses. I have one. and they're expensive. Baby mattresses are the same, nearly the same price as adult mattresses. So that's null and void there. Most people have one. And as we can see here, it's thick and it causes an incline, as we talk about, and not even just the incline. What is that kind of a seesaw effect to the mattress? Terrifying. So the reason I actually have one is because my husband bought it. Okay, he is not in medicine, but he is in tech, and he's never been sleep deprived. Okay, he didn't go to residency. He's not in the medical field, and he's like, what is sleep deprivation? I never want to experience that in my life again. So he is one of those vulnerable parents that went online to Amazon and bought all these things. And he asked me my permission. I said, and again, as I tell families, as long as it's safe and it doesn't cause harm. And of course, to keep my marriage alive, I didn't just say no outright. I let him buy it. I let him try it in the daytime. And you know what happened? My son's mattress was a seesaw, and my son went, "Ooh." And immediately I snatched it out and I said, absolutely not. This is not okay. My marriage is safe and my husband will never buy such a thing again. So if you can't tell, I would never recommend this product. Sorry, let's get that out of the way. It violates the recommendations of placing baby on a flat, firm surface.
You can put it on either side. Give two of them. They're very simple.
Sure.
Run.
Right.
And if you buy now, you'll get the second one.
I learned about this one from Dr. Ibrahim, and I thought it was pretty cool. It's actually a smart sound machine. It uses fun colors to help kids learn when it's time to wake up. They recommend the use as early as 2 years of age. Would you guys recommend this to your families? Yeah.
Is this a wake association?
Yeah, it'll change that sound machine, like if you set it, it'll say like, you can get up at 7:30 and it'll turn green at 7:30 and they're like, oh. Okay.
So it keeps the kid in the room and not to run out and wake parents, keeps them in the bed.
For me. And I just keep hitting buttons and first change, but I had no idea.
How to use it?
Companion app, you have to download the companion app, but you can, like, the top is like a.
But I think it's more for your toddler than your infant. For your infant, you can use the sound machine part, but for your toddler to kind of help with the, okay, this is the time that we're in bed, you know, and keep them from coming out of the bedroom, of course. And I think it's a safe alternative to locking kids in the room. Like, you're locked in until 7 a.m. Do you not recommend that?
That might be good for adults in a noisy, noisy city environment.
Yeah.
Okay, so the next two products are actually not tech, quote unquote. These are just some miscellaneous things that I found interesting and think we should talk about. So this is Frida Baby. It's a very common fancy brand, not fancy, it's a portable brand that a lot of parents know about. And these are lavender vapor drops. So it's lavender aromatherapy that people put in beds. I was trying to do research across the board from adults to infants, and overall, it doesn't cause harm. Some people suggest that it helps reduce crying in the infant, cortisol level in parents, and even helps babies with colic. And then some studies, they talked about increasing deep sleep in infants, which of course, now I'm a sleep physician, I'm like, define that more, right? And when they did, they talked about REM, and I was like, I don't know. So I'm interested to see more studies on that and see what metrics they use to truly define deep sleep. And if they're using EEGs, how do you know that? Or are using the outlet to say, this is deep sleep, this is soft sleep. So I don't know, Dr. Stroll or any attending, have you guys come across lavender and patients and any efficacy that you guys can, subjective or otherwise?
Unpublished data on adding lavender to CPAP humidifiers to see whether or not that improves.
Oh, what did you see?
That's in Japan.
Oh.
They haven't published it.
Cool. Okay, so I'll be interested to see that. Dr. Stroh said that there is a paper that they're working on in Japan of adding lavender aromatherapy to CPAP machines and see if that has an effect. So I'll be interested to see. So again, I'm okay with it. It doesn't cause harm. And if it helps relieve stress in families, I'm all for it. I remember in residency, there was a family that came in with a colicky baby, and the dread in their faces and the defeat that they had. They loved their child, but they absolutely couldn't take another minute. And the treatment that I offered that day was for me to snuggle the baby and for them to sleep and close the blinds, turned off the lights, and they slept for a couple hours, and then I discharged them. So sleep deprived parents, it really is stressful. And that's why I think it's important for us to review these things and not only just say, no, absolutely not, adhere to what we say, kind of meet the parents where they are and recommend, if these things do help and it's safe, why not? You know, their quality of life is important. And as we all know, sleep deprivation is not good for anybody.
Yeah, colicky babies, we should talk about that.
Okay. And then this last one I wanted to talk about is a trend, satin and silk lined bonnets. Since we've introduced the Back to Sleep campaign, babies, I don't know if you guys seen them around, they have this bald spot in the back of their head. My son has one, it's very common. And families and social media, they've kind of implemented this to prevent the balding in the back of the head due to that constant friction, right? That silk and satin, it doesn't cause the damage to the hair and then ultimately for the hair to fall out. Would you guys recommend this to your families? Exactly, especially not when sleeping. And look how loose they are. They're not fit to the infant. These can easily, I mean, they're so cute. I mean, look at it. They have matching ones with the mom, but absolutely not. I would not recommend this. This can lead to, of course, strangulation. Alternatives to the bonnet, though, again, because this is where you meet families in the middle. To us as pediatricians, we think that is a small risk for my baby being alive and safe. But to some moms and families, having that bald spot, it means something to them. They are embarrassed. They want their kids to have full, luscious hair, maybe a cultural thing, personal thing, whatever reason. I understand. I am in the business of treating humans, not just statistics and diseases. So I'll meet you in the middle. There are alternatives to it. There are silk and satin lined sheets, crib sheets, snoo sheets, bassinet sheets, all sorts of mini, large, whatever they have at home. And it ranges anywhere from $10 to $100. So you can get the satin one for expensive, or the satin one cheap and the silk ones for expensive, which they both do the same, honestly. And then they even have the lounge covers, you know, for during day, not while sleeping. That's why I picked a baby that's awake. And then the car seat headrest, you can also use that, right? Because these are babies, these are all the surfaces that babies are on throughout their kind of first year of life, causing that friction, the constant rubbing their head. So these are alternatives to that. So we're not just telling families no, we're handing them something to kind of address that concern that they have.
My father always said that grass doesn't grow on a busy street.
Hence the friction. That's so true. So I really enjoyed diving deep into these recommendations, going through some of these products. Wow, are there a lot of products out there? And I'm very happy that I increased my knowledge base and I can have these conversations with families. And I hope that you guys feel empowered and confident to do that too. Thanks for listening. Any questions or comments?